Well, healthcare and public health policy during a pandemic could not be more important. But like many other facets of life, this too has been politicized in the U.S. ahead of the election. Well, for more perspective, I'm joined live via Skype by Professor Paul Ginsberg. He's the director of the USC Brookings Schaeffer Initiative for Health Policy. He's also the Leonard D. Schaeffer Chair in Health Policy Studies at the Brookings Institute. Good to have you on.
A pleasure to be here.
So just how important is the pandemic response and healthcare in general to voters in this election?
Well, yeah, they're both really important. Let me focus on healthcare because healthcare is very uncertain now. There is a Supreme Court that is taking up a challenge to the constitutionality of the Affordable Care Act. And, if the Supreme Court literally endorsed what the lower courts have done, the entire Affordable Care Act would be abandoned, and that would cause immediate loss of health insurance coverage for many millions of people.
And certainly something a lot of people were worried about as we have now a new Supreme Court justice sworn in just a week before that election. Now, I want to focus on the differing plans that the candidates have. We know that President Trump has been promising a better healthcare plan and mentioning some elements for a few weeks. But what has he actually said in terms of the comprehensive outline of what it entails and how he plans to pay for it?
He said nothing. And this has been going on since 2017. When the president attempted to repeal and replace the Affordable Care Act. But a replacement plan has never come together, and many people that I speak to believe that it does not exist. So there would have to be some real scrambling should the Supreme Court act unfavorably, although I should say that most people do not expect the Supreme Court to overturn the Affordable Care Act.
So what do we know about some of the parts of the policy that were taken away and what we can expect under a future, perhaps, President Joe Biden?
Yes, well, I think, under a President Joe Biden, he's been clear that he is not a single payer or Medicare for all, but his program is to build on the Affordable Care Act by making more people eligible for it, making it even more attractive to states to expand Medicaid. So Medicaid expansion will become the norm throughout the country, and spend a lot of money in many ways to improve the structure we have right now.
So then, as we look at the Supreme Court pick now, and how do you see that affecting Biden's plans on what he plans to build on the law should he be elected?
Unless there is a immediate need to change the Affordable Care Act to make it consistent with the court's judgment as to what the Constitution applies, I think it'll be full speed ahead for him. I don't think many of the issues in expanding on the Affordable Care Act would generate constitutional issues, and that it's really all going to be the politics in Congress that determine what we get.
Now, we know that COVID is, of course, taking all the headlines, but there's also been at the expense of the focus on other medical conditions. What are the other voter health concerns beyond COVID?
Well, actually, there are many. Almost everything is linked to COVID at the moment because there are many concerns about people's fears of avoiding medical care for other conditions because of COVID. May lead to more strokes, more heart attacks, many other healthcare consequences, and that's a real issue.
Now, you also have healthcare workers who are on the front lines, and then you also have Big Pharma trying to race to find and fund vaccine research. What are those industries' hopes and expectations for this election?
I don't think for pharmacy manufacturers, I think their vaccines will probably be treated the same way and paid for. I think there are concerns that a Biden administration may be more restrictive as far as pricing and may develop mechanisms of negotiation of prices. He's often alluded to the model in Germany that has interest in replicating it. I don't know what to make of President Trump, who has spoken about lowering drug prices for his entire term, but has never really stepped up and done anything about it.